Hi, today we are going to learn about INBDE sample questions. Question 1. Which of the following is the most common lesion of the mandible? Squamous cell carcinoma, amyloblastoma, adenomatoid odontogenic tumor, osteoclastoma. Answer is amyloblastoma. Amyloblastoma is also called as a multilocular cyst. It is usually unicentric, non-functional, intermittent in growth, anatomically benign and clinically persistent. It is benign, locally aggressive neoplasm arising from the odontogenic epithelium, and it occurs mostly in the mandible, molar ramus area. So the answer is amyloblastoma. Question 2. Which of the following lesions does not give blood on aspiration? Globular maxillary cyst, nasopalatine cyst, Stephan cyst, and traumatic bone cyst. The answer is Stephan cyst. Static or Stephan cyst is due to the developmental inclusion of salivary glandular tissue on the lingual surface of the mandible below the mandibular canal. So the answer is Stephan cyst. Question 3. Which of the following bone lesion exhibit honeycomb or soap bubble radiographic appearance? Odontogenic keratocyst, enumeral bone cyst, eruption cyst, glomerular maxillary cyst. The answer is enumeral bone cyst. Anumeral bone cyst is a false cyst because fluid-filled cavity is not lined by epithelium. It is a lesion of the young person mostly occurring in the long bones and vertebral column with history of trauma. Upon entering the lesion, there is a excessive bleeding and the blood welling up from the tissue. The tissue resembles a blood-soaked sponge with a large pores representing the cavernous spaces of the lesion. The answer is anumeral bone cyst. Question 4. Glomerular maxillary cyst present between the lateral incisor and the cuspid in the premolar, molar region, mandibular region. The answer is lateral incisor and the cuspid region. It is found in the bone at the junction of the glomerular portion of the median nasal process and the maxillary process. Radiographically, it represents the characteristics of inverted pear-shaped radiolucent area between the roots of lateral and the canine. It is also called as a premaxillary suture. It is formed sometime in the suture between the premaxilla and the maxilla, the incisive suture. Though it is classified as a developmental cyst, research suggests that it is odontogenic in origin and histologically closely resembles an odontogenic keratocyst. So the answer is the glomerular maxillary cyst present between the lateral incisor and the cuspid. Question 5. Nasolabial cyst arise from remnants of cell rest of malleus, remnants of cell rest of serous, remnants of cell rest of embryogenic lacrimal duct, maxillary sinus. The answer is remnants of cell rest of embryogenic lacrimal duct. Now we are going to see some cyst and the radiographic features. Cyst, median anterior maxillary cyst, that is nasopalatine cyst or incisive canal cyst. It is a developmental or fissural cyst. Radiographic features: ovoid or heart-shaped radiolucency between or above the roots of the maxillary central incisor. Median alveolar cyst. It is a odontogenic cyst. It is a rare cyst arising from anterior to incisive canal in the alveoli. It is a primordial cyst developing from the supernumerary mesodens and hence odontogenic in origin. Glomerular maxillary cyst. It is a developmental or fissural cyst. Inverted pear-shaped radiolucent area between the lateral incisor and the cuspid, multilocular or unilocular, well circumscribed lesion in the midline of the mandible. Nasolabial or nasoalveolar cyst. A soft tissue cyst arises from the junction of the medial nasal or lateral nasal and the maxillary process. It has no radiographic features. Thank you.